Welcome, everybody, to Pfizer's Takeover, the Podcast Lounge. I'm your moderator for today's discussion. I am really excited about this discussion. We have some amazing panelists doing some amazing work in our fight against cancer. So I'm really looking forward for them to shed some light on some of the work they're doing. But before we get started, I really want to thank everyone that joined us. You guys can be anywhere in the world, but you guys are here with us. We very much appreciate it. As the title stated, Outdoing Cancer is a team sport, so each of you have a critical role in helping us achieve this bold goal. So thanks again for joining us. Now, to my lovely panelists, it's so nice to see you.
Good to see you.
I definitely want to say happy Women's History Month. I am very honored and thankful to be sharing the stage with you all.
Absolutely.
So I have the benefit of having a relationship with each of you, so I happen to know how awesome you are. So to get us started, it'd be great for you just to tell us a little bit more about yourself and what you do. Carmen, you know what? You keep looking at me. We can get you started.
Okay, I'll get started. So hi, everyone. I'm Carmen White. I serve as the U.S. and Global Health Equity Lead for Pfizer Oncology. And internally, I work cross-functionally to help set the strategy for health equity. But externally, I work with community leaders to find out what the unmet needs of our patient populations are for oncology and how we as Pfizer can serve to make sure that we insert the patient voice into everything we do and we're addressing those needs to close healthcare disparities.
Thank you. Pam?
Hi, everybody. I'm Pam Traxel. I'm with the American Cancer Society Cancer Action Network, or ACSCAN for short. That's definitely a mouthful. Our job is to be the public policy arm of the Cancer Society and really talk to elected officials and the American public about why public policy makes a difference in the fight against cancer. So I want to just tease out something for you for just a brief second. So have you ever been to a bar where you weren't allowed to smoke? That's a smoke-free law, right? And that comes as a result of the work of the American Cancer Society and ACSCAN. We personally believe at the American Cancer Society that public policy is as much a part of the fight against cancer as cancer research, and I'm really excited to be here today to talk about that.
Thank you. Come on, Mary.
All right. I'm Mary Stutts. I am the CEO of the Healthcare Businesswomen Association. We are a 50-year-old organization, and our mission is to further the advancement and impact of women in the business of healthcare. We are in 80 countries and 6 continents, all continents except Antarctica, and I've already informed them we won't be going there under my tenure because I don't do cold. However, we do have 160 corporate partners, and we are in the midst of a massive expansion globally so that we are continuing to create women leaders for life. That is our vision, and when we say for life, it's obviously a double entendre for the lives of their careers as well as for the lives of the patients that they are treating and working for in the industry. And I am very excited to be here with you today.
Awesome. Well, thank you guys for the introduction. I keep telling you guys you're really awesome. So let's go and get started. So I think, Mary, I want to start with you. We're going to jump around a little bit, but I'm going to start with Mary. All right. So each of you comes from a different angle, right? I'd love to go down the line and hear a little bit more about what do you think are the biggest opportunities for us to collaborate on improving health outcomes for all people with cancer?
So I think that it's interesting that women are the majority of the healthcare workforce. Globally, we're 80% of the healthcare workforce in the U.S., 65 to 70% in the rest of the world, and yet the women's health gap is horrible. Women and younger folks are bearing the brunt of the gaps, especially when it comes to cancer, and we're seeing that women are the ones who are having the worst outcomes, and a lot of that is because the physicians don't listen to them, don't take them seriously when they voice their concerns. And by the way, that's all women. I did the first diversity and clinical trials initiative in the industry when I was at Genentech. And what we found then, we're finding now, which is that women, no matter what ethnicity or race the women are, and people of color are not getting access to things. They're not being offered the option to things like clinical trials, to the newest, most innovative therapies. Their concerns are not being taken seriously, so that by the time they finally get a physician to pay attention to them, the disease has progressed to stage 3, stage 4, and especially women of color are seeing that even more so, and so the outcomes are horrible. So there's the work that needs to be done is just what the title of this panel is. It's a team sport. We have to work to address the bias in the physician community. We have to fix the medical education model because physicians are not being trained. There is such a huge gap if you look at medical school between, everything is based on the male anatomy. Only about 20% of the anatomical designs in medical school textbooks are women, less than 10% are men. The gaps are huge.
Yes, they are.
And I will talk a little bit more about the studies and what we've done. But at the end of the day, the gaps are there for women especially and people of color, and that's why we are not seeing the progress. We're not benefiting from even the research that we should be benefiting from when it comes to cancer.
Agreed. And I think that's a great segue to go into Pam, right? So we think about access, health equity, and making sure the patient voice is heard. I can't help but think about, American Cancer Society, so I would love to get your thoughts on this.
Yeah, the American Cancer Society is really committed to our mission of making sure that we end cancer as we know it for everyone, men and women, right? Regardless of where you live, regardless of your sexual orientation, the whole thing, right? So when we think about women in particular, I always like to say women are the chief medical officers of their family,
Ain't that the
right?
truth?
Like, so those of you that are in a relationship, maybe you might have experienced that. The thing that's really interesting about cancer, Tyrone, is that we actually can prevent 40% of all cancers with stuff we know right now.
Yeah.
Not the amazing stuff that Pfizer's doing, although Pfizer's doing amazing stuff, but really focusing on living healthier lives and knowing more about your cancer risk. So one of the things that the Cancer Society just released is a new tool called Cancer Risk 360. So we partnered with Pfizer on this. You can see it at cancer.org/cancer risk. It's a really simple test you can do on your phone to evaluate your risk of getting cancer, and it makes recommendations about what you need to do. So I tell people all the time, cancer is the scariest word in the English language, consistently, has been for years. But this doesn't mean that you can't do something about it, right? So doing something about it is understanding your risk, right? Understanding your family history, and then really taking positive steps forward. This is where we, as we educate everyone, can start to really resolve disparities, because everyone needs to understand that regardless of your background, your health insurance status, where you live, you have an equal opportunity to learn about how to prevent your cancer.
Thank you for that. And Carmen, I know in oncology collaboration is huge. So, what are you most excited about?
So I think there's always an opportunity to collaborate where we can address systemic barriers to care as well as facilitate access to care. So Mary and Pam gave great examples about how we move patients into understanding and creating awareness around clinical trial participation and what that means to them, as introducing it as a part of the healthcare continuum and not just something to consider at end of life. How we move policy forward, how we create education and awareness and help patients navigate their care, and not only the patient navigation of care, but caretakers as well. So creating support for them. I think there are opportunities to collaborate around how we address the whole health of both the patient and the caregiver. And lastly, wherever we can close gaps to creating access, awareness, and education around early interventions and screening, diagnosis, and treatment management.
Thank you for that. So we think about closing the healthcare gap and these innovations coming to the market, right? So I heard Pfizer has a bold goal by 2030 to bring 8 major breakthroughs to the market, which I think is pretty ambitious, right, and awesome. I heard one way you're doing this is through community partnerships. Can you tell us a little bit more about what that work looks like? I heard that there's some work that you're doing in Texas that may be able to scale to be helpful with these breakthroughs. Could you share more details about that?
Sure. So first I want to set the foundation of how this work was originated. So Pfizer's Oncology Patient Solutions Group, we developed the Pfizer Oncology Patient Centricity Ecosystem, and that is a mouthful, but it is the example of collaborating with advocacy groups, professional relations organizations, and Pam's organization is one of our valued partners. And through that work, we are able to take insights that are actionable from our patient advocates. They help inform us on what the unmet patient needs are and how Pfizer's efforts can address them. So and we work with over 65 organizations to shape the work that we do, which leads us to our Texas cause work. And so cause is not an acronym for anything, but it's our challenge to address unmet needs in certain locales in the US and globally. And what we noticed, we looked at screening data pre and post pandemic and saw that there were disparate trends around patients returning to care after their cancer diagnoses. And though this was a national trend, we saw that specifically in Texas, the rates were even higher. And when we looked in Texas, we saw that in Houston and in Dallas, the rates were increased. So we partnered with over 41 advocacy groups, national and local partners, and said, how can we address this problem collectively? So how can we bring community together to create a solution for community that will be utilized by oncology patients and their caregivers? So the effort that we identified is how do we not close the gap for patients receiving treatment, but how do we match those patients with the resources that are preventing them from getting their treatment? So those resources connected to the social determinants of health. So when we think about food security, health finance literacy, transportation, elder and child care, how do we match those patients to those resources in an efficient way? And we thought about the dissemination of information through pamphlets. We thought about all of the channels that a patient could potentially follow to get that information. And then we thought about who's that trusted source and community that a patient engages with along that journey. And we identified the patient navigator and community health worker or promotores as an opportunity to create connection with those patients in a trusted way. And the facilitator of that would be through a technology. So we thought, could we use AI to develop a resource that could match patients to those resources? So over a 2-year period, by having listening sessions in those communities, testing continuously to come up with our first iteration, we created through an incubator, we created an example of a tool that we've tested it last year we took it back to these stakeholders, and we think that there's an opportunity for it to live outside of Pfizer's walls in the community. So we're in the process of handing that information and the source off to a nonprofit partner to continue to build now that we found measurable success in community potentially.
So this is really awesome because, it may be cliche, but they always say teamwork makes the dream work, right? So in our work, it doesn't work without partnerships, right? So what's amazing through this, American Cancer Society has been with us from the beginning of this journey, this POPSI initiative with Pfizer Oncology. From, dissemination of the white paper to this Texas initiative to now to the Change the Odds initiative that aims to address cancer care disparities and improve health outcomes in underserved communities. Pam, you've been on this journey with us. It'd be great if you can just elaborate a little bit more on these programs and any other big programs aimed at addressing health equity.
Yeah, I do think that the POPSI initiative, maybe in the beginning, I thought, okay, this is just going to be a way for Pfizer to hear from patient groups. And that's really important. But what I was really surprised about is that when they identified the problem here in Texas, and they called me and they said, do you know that in Texas, and not just all of Texas, but in certain parts of Texas, men aren't getting prostate cancer screening, women aren't getting breast cancer screening. And it's like, well, that's going to be bad for us, right? That's bad for the patients, but then we're going to get all these phone calls. And they said, well, we want to do something about it. We're not just going to sit on the data. So really working with Pfizer and the POPSI team to create this AI tool has been a really important journey. I think for the American Cancer Society, it really pointed out two important things. One is listening to the community is humbling. I'll never forget sitting with some patient navigators in Houston. They talked to me about how they navigate their patients. One lady told me she had a notebook. She writes the resources down in pencil so that if things change, she erases them and writes something new in. I immediately thought, we can do better than that. It is, at this time, 2024. I think there's a computer that can help you. And I was also humbled by the fact that while every single person that came knew the American Cancer Society, they didn't exactly know what we could do for them. They didn't know that we had Hope Lodges. They didn't know that we provide rides to service. And that candidly didn't feel so good to me, right? That was like a very real moment where I thought, well, we need to lean in and do more. And so we've been very proud to partner with POPSI. We've been very proud to take that work actually and work with the federal government to create reimbursement for patient navigation for some sets of patients, because we really see like how important patient navigators are in delivering service. But then we've expanded it even more with our Change the Odds initiative, which is really around exactly what it sounds like, changing the odds of people getting screened from cancer and surviving their cancer. And this is really focused on a couple things. It's about reaching patients in rural communities, of which there are many here in Texas, but obviously all across the country. We've done some really amazing PSAs with Patrick Dempsey, who's an amazing actor, but is also grew up in Maine, believe it or not. And really has a lot to say about what it's like to drive really far for your health care. There is so much that we can do. I think a lot of times people, we talk about partnerships, and people have like a version of a partnership. For me, our partnership with Pfizer is a true partnership because it's around talking about what's going right, but also what's going wrong, and how we can work together to really think about what each part of us that we can bring that together, and how we're not afraid to bring in other groups to really help make a difference. Because in the end, cancer is taking too much from too many, right? We know over 2 million Americans will be diagnosed with cancer this year, and over 600,000 Americans will die. These are people we know and love, and it's an imperative that we work together, not separately, to make a difference in this disease.
Absolutely. And I think that's a really good point, because cancer is taking a lot from other people, right? And Mary, I'm going to go to you on this one, because I think he was talking about just alluding to it earlier today, right? In the healthcare system, in order for these innovations to really work, we have to have representation where it really matters for the connectivity, right? So I'd love to hear more about the Healthcare Businesswomen Association and their work to empower women who work in healthcare and advance gender equity. Can you tell us a little bit more about your latest projects and the findings from them?
Absolutely. So a couple of things. People most trust people who look like them. That's not racism, that's human nature. So it's very important, as you're talking about making advances with cancer or any disease, that you have people who look like the patient, who is helping them. That's why the work you're doing out in the community is working. Yeah. Because you are working with the people who look like the patients. And so that piece is very critical. Now, I do want to just add in one piece here, because they were talking about AI. So, as I've said before, the physician bias is a real hindrance to medical advancement really helping people. And I know I sound like a dinosaur, but I was the first chief health equity officer at Stanford Healthcare. And when I was there, they stood up the healthcare AI group, and we did a pilot with AI then that was called ambient listening in the exam room. And they actually do it all the time now, and there may be other AI or, companies that do it. But the exciting thing about that, why I believe AI can help us, I know there are still some problems with it, but I do believe there's potential for us to help us, is that the ambient listening exam room is where the AI is listening to the physician but the AI is also listening to the patient. And by the time the physician gets back to his or her office, the AI has provided a summary of what it heard, not only what it heard, but also a summary of, based on what it heard, here are the potential clinical trials that might be available for this patient. Here are the potential new innovative therapies that may be available for this patient. Now, the exciting thing that's going to help us advance is that the AI puts that information in the patient's electronic health record. And so we always tell patients, you need to advocate for yourselves. The average person does not know what that means. So to say to them, ask for a copy of your electronic health record after you have had a medical appointment to see if the doctor put in there what you said were the symptoms. Make sure you are heard. And if you repeatedly are not heard, for God's sake, find another physician. You don't have to stay there, right? Yes, we could clap for that. Yeah. This is how you teach people to advocate for themselves. Also, tell them, ask the physician, what are my options? Tell me, what are all my options? The physician should not be deciding for you what are your options. You should be deciding that. Certainly you're going to take into consideration what they say, but if they don't even tell you what your options are, how are you even going to know what's available to you? So having that information, helping patients understand how to truly advocate for themselves, ask for their options, get copies of their records is very important. And then the other thing, what we have done, specifically focusing on trying to close that women's health gap, because again, women are the majority of the healthcare workforce. If women aren't healthy, the entire world is at risk of not being healthy. So we have to look out for ourselves. We did 2 studies through our HBA think tank this year, which we released at Davos. The first study was a study of the women who are members of the HBA. The HBA has over 160 corporate partners, global corporations, with combined workforce of about 5 million employees. So we have a great database that we can research. And so we researched the women who are members, and I think we got response from women in over 42 countries about what is the state of health care for women in the workplace. Are there companies keeping up with their needs? And what we heard from many women was about the numbers of days they had to miss work for healthcare issues, and that their companies didn't necessarily provide the best benefits. Some of them did, but also we heard about the stigma for women of even being able to talk about their healthcare needs. And then the other part of that survey was about AI. We asked them how much they understood AI and if they felt AI could help. A lot of them did not understand AI, but they did feel it could help. And so there's a huge opportunity there to continue to educate the workforce about the benefits of AI. The second survey was a survey of physicians, where we surveyed physicians globally, not primary care docs, but specialists, because it's the specialists who put you in trials and prescribe the newest, most innovative therapies. We talked to oncologists, ophthalmologists, endocrinologists, neurologists, and cardiologists. And what we found, we asked those physicians how prepared they felt to treat women. And surprisingly, over 80% felt that they did not have all of the information they needed to successfully treat women. Yeah. They did not have the number one thing they didn't have, clinical data. Why didn't they have it? Because women are not included in clinical trials. They don't have enough information to help them understand the adverse impacts that medicine can have on women. So they said they don't have the information to understand the hormonal impact that women have various hormonal issues. Because let's just make sure everybody's clear in here. Men and women are biologically different. Everybody on board with me for that? Okay, let's start right there. And so the hormonal differences in women have a significant impact on their reaction to the medications, and that's why you're periodically hearing about these very negative impacts, diseases on women that weren't tested on women. And then so the hormonal impacts. The other thing are diagnostics.
Yep.
They do not have diagnostics to help them diagnose diseases. And even when, as I said, women are giving them their symptoms and all of that, but a lot of times there aren't the diagnostics to actually accurately predict what is wrong with them. So that's just something. You can go to our website, hbanet.org, and read both of those reports and get that information. But that's why we're doing, much like what the American Cancer Society and CAN is doing, you have to have data.
Yeah.
Art Levinson, the CEO of Genentech, when I was there, and we knew as executives, look, his motto was, "In God we trust, all else must bring the data." So that's why we're very much focusing on getting the data behind these challenges so that we could start to address them.
So I think that's a good point right there. I just want to pause real quick because I think right now we're starting to find our stride right now. We're starting to cook. I'm starting to feel a little inspired right now. So let's lean into the title just a little bit more, right? So as we said, Outdoing Cancer is a team sport. How do you think organizations like yours that approach healthcare from various angles can continue to work together to knock out cancer as we know it? And how can we engage other potential players? And I want to start with you, Pam, on this right now because of all your collaborative work you do.
Ooh. So I'm going to get maybe a little controversial, so let's prepare ourselves. I think where we can collaborate the most together is around public policy change.
Mm-hmm.
And why? Because, we've talked a lot about the individual patient, right? We talk about the individual doctor. But if we're really going to bring change, right, to cancer, we have to work at more a system level, right? And so when we think about systems, I'm not talking about, a hospital system. I'm talking about our healthcare system or the lack thereof because it's not really a system. So really thinking about how we can prioritize policies that allow people to live healthier lives and survive their cancer. So there's a lot of controversy about this right now, but things like having health insurance are really important. The American Cancer Society actually did a study that showed that the number one thing that a cancer patient needs to survive their cancer is health insurance. Because if they don't have health insurance, their cancer is diagnosed a full stage later. Mm-hmm. Once you have your health insurance, you need to make sure that you actually can get covered for the things that your doctor needs or that you need to navigate your care. And here's the most important thing. We don't do it alone, right? Everybody needs to work together to share their stories, to share their perspectives, to talk to representatives about why this matters to them. That's why it's a team sport, right? This is the ultimate team sport of going and talking to people here in the state capitol. I know we're all here at South by Southwest, but the Capitol building is just up the street. You could go up there. You can talk to your members of Congress about why this change is important. I think one of the hardest parts of my job and the hardest part of my organization's job is getting people to understand why public policy intersects with cancer. That's why Pfizer is such a good partner, because you all understand that very, very well, because it's that kind of change that we need to bring, right, to resolve our situation with cancer right now.
Thank you, Pam. I mean, for some of us, public policy is our love language, so I'm glad you leaned on into that.
It is my love language, and it's not only is it my love language, I want it to be other people's love language. And
Keep going.
Sometimes people don't jam on that, but I really think that, the one thing that I notice when I work with cancer patients is they always say something to me, and it's really poignant to me because they say, well, I'd love for this to never happen to somebody else. What happened to my family was horrible. What happened to me was horrible. I really want to make sure that this doesn't happen to somebody else. And while sometimes those people are scientists, right? Sometimes, rarely, but sometimes they're scientists. Most of the time they're not. They're people like me. I have a political science degree, which is not science. So I can't jump into a Pfizer lab and, culture something up and make a great therapy. But I can share my story.
Sure
and I can share my voice. And that's really what our organization is all about, is getting people to understand that using your voice That's powerful, right? That's how we make change. And that's why we're so proud to be here at South by Southwest, where so many people are talking about sharing their stories, creating their content, communicating with people in different ways. And that's at the heart of what we're trying to do as we work together to end cancer.
So, really good point on, part of the storytelling. When I think about knocking out cancer, I think about this incredible commercial Pfizer had, which was very inspiring. So, Carmen, I would love to hear from you on this topic as well.
So I'm the lucky one on this panel, I think, that has the opportunity to work end to end in thinking about the overall patient experience. And Pam touched on the incorporation of the patient voice. And I think what was so powerful about the Big Game ad was it did tell a story. It talked about the journey of that fight for cancer, and it's a fight that our patients, as well as their family members and caregivers, face every day. But how does that storytelling shape how we are educating communities? How does it shape how we are removing burdens from clinical trials by having the inputs of patients to understand procedural requirements, burden, time, etc.? How are we closing the gap from diagnosis to treatment for patients and ensuring that they understand the required guidelines for getting screenings and what they can ask for, and knowing that they can ask for their EHR data, and doing that not alone via Pfizer, but through our partners who are the trust makers, who are the facilitators, who are the sharers of information, because Pfizer can't do that alone. So we need their stories. We need them to amplify the stories in partnership with Pfizer so that we can make sure no matter where someone lives, where they work, how they play, they are able to get early and quality access to care.
Great. But before switching gears, I would love to hear from you, Mary, on how we can engage other potential players.
Yeah. I think what you've heard described here is really a big part of how to do it, is identifying who are the key players and trying to pull in folks from all the different stakeholder groups. But one of the things that we've had to focus on, even as we look at the industry itself, and holding the industry accountable to make sure that they are understanding what is happening with the patient experience, whether you are, a biopharma company or a healthcare provider. How are you connecting? Are you practicing cultural humility? When I was on the consulting side with Real Chemistry, some of the things we did was the cultural humility work for the companies themselves, for their MSLs, their medical science liaison, their field force, the folks who are calling on the physicians to make sure that they are understanding about not cultural competence, because you can't become culturally competent in another culture that's not your own. So you have to maintain cultural humility and make sure that you are listening, you're asking questions, you're respecting what people are saying, but also to get to a lot of the assumptions that's causing our industry and healthcare industry overall to leave a lot of money on the table. So there's a business imperative for doing this as well that sometimes we miss when you talk about health equity and the billions of dollars that's being left on the table because we are not practicing cultural humility, because we are assuming, for example, that all black and brown people are poor. I can't begin to tell you how many times when I was working with marketing and commercial teams, and they had a new therapy that they were about to launch, and they wanted us to help them with that. And when I would start to talk about the diverse populations and how literally they would say to me, oh, yeah, we're going to do something for the Medicaid population. And I thought maybe it was a one-off, but when it kept happening, I finally was like, do I look like I'm on Medicaid? Every black and brown person is not poor. We work, we have jobs, we can pay the copay. Why are you assuming that? And so because of that, they literally we're not doing campaigns to target diverse populations to let them know about these therapies so that they could get access to the newest, most innovative therapies and know about them just like everyone else. And you see more and more companies are doing like multicultural marketing and stuff like that now, but still, in the healthcare industry, we are behind because of a lot of the inbred bias and stereotypes just within the industry workers themselves. And it's really very upsetting, but that's why we have to be vigilant and look at all the stakeholders. The patients aren't the only stakeholders. Yeah.
And I think there's an opportunity to remember that diverse does not mean other.
Yeah.
It's inclusive.
Yes.
Yeah, I think you're raising such a really important point. Cancer doesn't care what you look like.
That's right.
Doesn't care where you live. Doesn't care how far it is to the doctor. And somebody is diagnosed with cancer in this country every 15 seconds. We've been up here, half an hour?
Yeah.
Do the math. And I think that that's something that it's a great equalizer, and we really do need to really think about it being a team, right? Because there's a lot to be learned about everyone that has cancer and everyone sharing their story and their experience with the disease, because like I said, it does not matter. There's not a single person out there that can say, oh, well, you're going to be fine. You're not going to get cancer. Literally, I tell people all the time when I'm working with somebody, I say, so when you had a doctor's appointment, you went to the doctor, you did your exam, your physical exam, whatever, maybe they ran a blood test or something. No one walks into that office saying like, oh, I know they're going to tell me today that I have cancer. No one's waiting for that, right? So this is something that we all have to work together to prepare for, because it does come out of nowhere, right? And we have to really think about how we can support people in that journey. And that's why working together is so important, because people have a lot of needs when they have cancer.
Absolutely. And I think cultural humility is a very important word that we need just to focus in a little bit, right? So when I hear this, I think about patients themselves. And a lot of these initiatives, from your work, we all know that, most patients say for us, by us, we should be included, right? Which means they want to be part of the conversation, the development, right? So Carmen, I want to start with you right now, because I think this is really important in your role. Where do patients themselves fit into your initiatives that you're putting together? And, how does patient centricity shape your work?
So one of the great platforms that really champions the patient experience is This Is Living with Cancer. So the website was developed in 2017. We've had over 5.5 million visitors. We have resources that are supplied by over 70 organizational partners, because what's really important is that we make sure that the content that's shared is diversified, that it's not just a single voice. And I think when people hear consistent messaging from multiple stakeholders, then they can say, this is true. When they see the stories of people who reflect their experience, who have gone through navigating financial hardships, we have another website, My Healthcare Finances, that is free and gives information around a lot of the topics that are of concern to the oncology patient community. But it's through those external facing resources that I think we are able to help meet patients where they are. And also when it comes to the incorporation of the patient voice, our healthcare professionals are going to be the conduit of any information that's shared. So it's important that we utilize the patient feedback from our partners within POPC and our steering committees, so that we can share that back with our healthcare community partners, so that they're aware of how to be effective in having a conversation with someone, making sure that we're addressing language barriers, whether it's spoken or signed, and creating those opportunities for patients.
Yeah, I was going to say, everyone can help. Even if it's just focusing on prevention and encouraging your own family and loved ones to get screenings. We are in the midst, as I mentioned earlier, of a massive global expansion with the HBA, and we're expanding into all these countries, into Dubai, into India, into Japan. And we're doing these leadership roundtables as we are doing that. And at the the big expansion in Japan, I was shocked to hear that the number one killer of women in their 30s and 40s in Japan is cervical cancer. There is not only, there's a vaccine for that, but also the early screening, but they don't do screenings there because of their culture. It's kind of like a taboo. It's an embarrassing thing to talk about. So clearly for us, when we did our roundtable, talking to the leaders saying, how can we help? Well, first of all, make sure you're doing these prevention campaigns in your companies for your employees. Make sure the screening is covered with the insurance. It's these kinds of things that are the reasons people are dying, because as Pam already said, a lot of it, we have the answers. We have the cures. But if people don't know, you would think that Japan is a super westernized country with lots of resources and healthcare. You would think that that would not be the issue, but it is. So I think all of us carry that responsibility now that we know, and we do know here, certainly in the U.S. and in your organizations where you work, the value of prevention, and you can't unknow it. We can't unknow it. So it's a big part of it is on us to be that voice and to not be quiet about the potential impact of cancer, but also how to stop it, undo it in the first place, with a big focus on prevention and education and screenings.
So prioritizing patient centricity takes a lot of courage as far as I'm concerned, right? Because it has to start with inside, right? So in order to start with inside, you have to be a firm believer in it, right? And it also takes a lot of institutional commitment to cultural humility. I'm having one of those days. Cultural humility and equity. How are you working to promote and uphold equity within your organization, Pam?
So first and foremost, not backing away from it. So our mission statement is to end cancer as we know it for everyone, and we mean for everyone. So as the political winds change, we do not change. We actually have doubled down to do more, to reach out to different voices, to celebrate those voices. And we feel very strongly. So just actually in the past several years, ACS CAN, like a lot of other organizations, is a volunteer organization. We have over a couple 100,000 volunteers across the country. We created volunteer affinity groups. So we've got a Black Volunteers Caucus that is focused on the problems in the Black community around cancer access. So they've been working a lot on clinical trials. So this is people in the community talking about the solutions they want to see in the community by, ACS CAN's almost a 25-year-old organization. And I think part of what we have to do is create space for people to talk about their problems with people that look and think like them.
Yep.
And then support them and bring that idea forward. This just can't exist in a vacuum. I tell people all the time, I would love to say that there's a set of people out there in the United States that do not get cancer. That is not true. So we have to meet people where they are, and more importantly, we have to work to encourage them to share their stories. It's difficult when you are on Medicaid to share your story.
Yeah.
It is difficult to tell someone that there was a time where you could not put food on your table to feed your family because you were trying to decide whether or not to pay your doctor for your cancer treatment or to feed your family. Quick answer, you feed your family.
Absolutely.
But then how do we create a healthcare system where that is a choice? So I think part of it is, it's not just cultural humility, it's actually like really recognizing people for people, right? And the true problems that they have, regardless of who you are, right? Because that's where we're going to really make a huge difference, right? And I think we can't shy away from that. I know so many people say, well, are you going to change? I mean, until cancer changes, no, we're not going to change. This is who we are as an organization. We're here to serve every single person that has cancer.
So Carmen, hearing this, it just makes me, I want to lean into this a little bit with you, right? So commitment, right, in this new day and age, and we talk about health equity and not moving away. Like, tell me a little bit more about how you guys are upholding this, and has anything changed in your role with this day and age right now?
So nothing has changed in my
Business
role.
as usual then?
Business as usual.
Okay.
I mean, I'm really proud that, equity is one of our core values alongside
Yes.
courage, joy, and excellence. And so I want to demonstrate that in everything we do in partnership with our external organizations that we work to advance access to care. So it's business as usual over here.
So switching gears just a little bit, and Mary, you started off with this a little bit, right? So we're in a digital age where we're able to get information at our fingertips really quickly, and sometimes we can get information out that doesn't need to get out. But so now that we live in this digital age and people around the world are able to connect more than ever, especially with the evolution of AI, what impact has technology had on your work? Or if it hasn't, what are you looking more forward to?
I think that the technology that is being developed by women, sorry, I am the HBA, so I'm going to talk about women, but the truth of the matter is the majority of the health equity innovation, and a lot of that innovation is digital innovation, the majority of that health equity innovation is coming from women. Because women have worked their entire careers in healthcare from entry level all the way up, but those women are not being funded. Their innovation is not being funded at the same rate as men's innovation. So a big focus for us at the HBA is making sure that women innovators are funded. We hosted our first pitch competition at our annual conference in Toronto this past September. And we had amazing participation, over 70 women-founded companies in that health equity space and beyond participated. And our corporate partners who have their own corporate investment arms where they invest in new companies. We wanted to bring them in to help them understand about all this great innovation that women are having, and to also fund the prize money to give them. So they participated. It was great. We had great participation. We were able to acknowledge these women, and that is a big part of the HBA's strategic plan going forward, not only addressing women's health and wellness, but also funding women innovators and making sure that all these brilliant ideas that women have in that digital tech space that actually will advance health equity and advance our industry, that it is actually being funded and being put on platforms and stages where folks with money can participate. We brought in, can fund it. We brought in venture capital firms at that event, and specifically VC firms that are run by women, like How Women Invest and Portfolio and others. There are actually quite a few. And making sure that we were educating the women of the HBA, who are very senior level women who attend our conferences, and high net worth women, to help them understand that there were organizations, funds that they could contribute to help support other women and fund women's innovation. And that has just really taken off. Everybody now wants to know, when is the next one? I'm like, my God, I'm still recovering from the first one, but we'll see.
Well, let's go, Mary. You really representing for Women's History Month. I really appreciate this. Oh, let's go.
Absolutely.
Pam?
I think to me, a couple things about technology. I love social media and our ability to connect with legislators. So one of our favorite things to do is when we meet with a legislator, take a selfie with them and tag them. Sometimes they retweet our stuff, and it's exciting. But I often think a little bit about some of our volunteers who are older than me, who are learning for the very first time how to use Facebook or Blue Sky or X or, whatever, Insta. And the empowerment that brings, and how proud they are to share with their family, how hip and happening they are. But the fact that they're really using that for change, I think there's a great opportunity for dialogue for people across the country to communicate with each other in a different way. I think the one thing that I worry about is the digital divide and the fact that there are so many people that can't afford to do that. When we think about, telehealth and things like that, one of the things we worry about is that you'd be forced to use telehealth. What if you don't have broadband? What if what if your cell phone ran out of minutes? So we have to make sure that this works for everyone. But I do think there's something really special about reaching people, connecting across, the country, across the world, sharing their issues in a way that you probably couldn't do before. We have a lot more, I think, to do to bring that forward. But right now I am really excited about the fact that, on my feed, I'm constantly looking at people tagging lawmakers, asking them to, increase cancer research funding or expand Medicaid or, that's really powerful. And that's so different than it used to be that it's really exciting to me.
Yeah, that digital divide is really real, and I think about underserved communities, right? So I want to ask you a little bit different question, Carmen.
Sure.
What is Pfizer doing to close that gap?
So we're definitely listening to community. When we think about those populations that are adversely impacted by earlier cancer diagnoses, we're thinking about the young adult community who are dying at higher rates because of late stage diagnosis. So we think about the American Native, American Indian, and Alaska Native community and addressing that digital divide, that the access to broadband, that the remoteness of a reservation from a healthcare facility, whether it's delivered by the reservation through healthcare services or Indian healthcare services, rural communities. We're really thinking holistically and listening to community about how we close that gap, because technology, yes, is a channel in which people can get information to educate themselves, create awareness, schedule a visit and an appointment, but it should be complementary to that high touch through just traditional information sharing with a person. And so we can't negate one for the other. They have to work hand in hand. So how are we preparing information so that it does exhibit cultural humility and cultural relevance to communities, to educate them and bring them along on the journey? So creating customized materials in languages, not just English and Spanish, wherever we can, addressing, we know in South Florida work that we're doing, introducing Creole translations for that community. So I think it really is looking at who is experiencing the disparity. How do we close that gap and really customize information wherever we can for that audience? And the other thing I'll say around technology is that there's such value in the work of AI, but we also want to make sure that we are accounting for those unintended consequences. There, in one of the earlier sessions, they were talking about how we train the model and ensuring that diverse voices are incorporated in the training of the model alongside healthcare professionals, so that the opportunity with even the tool that we are creating in Texas, we are not delaying patients' timely access to resources, that we're incorporating that as quickly as possible by creating a feedback loop and utilizing not only generative AI, but static AI as well.
So really quickly, one thing I do want to lean into technology before we switch a little bit is the ability to build community, right? I think what's the biggest thing we think about when we think about the disease types, right? So we're at a big stage right now with some people who are listening and watching, right? So can you share some community organizing efforts that you're taking part in, or something that you're planning in the future that you'd like to share?
Yeah, so we are doing so many things, so many places. So ACS CAN exists in all 50 states.
Yes, they do.
We go into every state capital. We go to the Hill. We are every place. What I love best about my organization is whether you have 5 minutes or 5 hours or 5 days, we have a volunteer opportunity for you to share your story and use your power. That starts by visiting us at fightcancer.org or checking us out on social. Even just following us is really, it's part of making people understand that people care about the fight against cancer. There is so much happening right now. And everyone has a lot of feelings. You know, the kids today, they say all the feelings. Yeah, there's a lot of feelings. You can do a lot with those feelings by getting involved and not just sitting back and being overwhelmed, but really thinking about what you can do in the fight against cancer. Because really, fighting cancer is a team sport. But in order for it to be a team sport, I'm going to take the analogy a step further. You got to get off the sidelines, suit up, right? Put on the pads, come, be an advocate, and share your story. Because people say to me, I can't do that. Your voice is your power, right? That's why you're here. So let's train that on cancer, because it can make a huge difference.
Absolutely. So this panel discussion went by so fast. I'm just having so much fun. I have two more questions, so I'm hoping we can get through this really quickly, right? So I kind of like to end on a positive note because I think we need some positivity, but that's not my last question if we get through it. So I'm letting you guys know that right now, right? But what I would like to hear quickly from you guys is, what's something that excites you about the future of oncology and our efforts to improve health equity?
It's always collaboration. Yeah.
I would say targeted therapies that are really focusing on different populations that experience cancer differently, and really offering therapy to folks who have multiple myeloma or some of these other cancers where you do tend to see a racial difference in the types of people that are being diagnosed.
Yeah, I agree with that. The personalized medicine possibilities that exist so that we can actually treat people more individually instead of mass treatment for folks, and that's where the potential of the diagnostics and even AI to a certain extent can help with that. And so very hopeful about all of that. But again, needing to remember where there are challenges. I was just in a panel yesterday with more folks from Stanford talking about AI and the fact that you can go get a lot of information right now, but there are challenges. So for example, they talked about how asking AI to give a list of all of the therapies for breast cancer, and it's a pretty exhaustive list, so it's very thorough. Patients can get that information now. However, when they went back and asked that same AI, give me a list of breast cancer therapies for a specific diversity, whether it's Black or Latino or whomever, the number was reduced almost 3/4.
So I think you're cooking right there. And I want to pause you real quick because I want to make sure we can get to my last question. And I think you're going to be able to wrap up with this, what you were talking about, right? So I was encouraged by a friend in the audience before we got started. And she asked me to make sure I asked this question. What are the key takeaways that you want people to take away from this conversation? We have a minute, so let's be quick.
Use all your resources. That's, to me, find out what all the resources are and use them all. Don't stop thinking. We can't rest where we are. We have not achieved nirvana yet. So use every single resource and option you have.
Thank you, Pam.
2 things. Know your risk of cancer and get involved.
Love it. Carmen?
I would say know your risk of cancer by sharing your family history. That's one of those pieces of the cultural divide that I think we definitely need to close. And also never forget keeping the patient at the center of everything that you do, because it starts and ends there.
Wow. Well, thank you guys so much. I'm feeling so inspired right now. Thank everyone for joining us. I really want to thank Ellen, Erica, and Mia for putting this panel discussion together. Thank you guys. I hope you enjoyed the conversation. If you're around, just come on and say hello. We won't bite.